Without objection.
Mr. President, since my first day here in the Senate, and even before that, one of the issues I have been working to address is how my own home state of Georgia, where state leaders have been digging in their heels, refusing to expand Medicaid, how it is that citizens can somehow provide affordable health care to their families. Nearly 500,000 Georgians who are uninsured. They are in the Medicaid gap. And that's why last week I introduced the Medicaid Saves Lives Act, legislation that would create a program almost identical to Medicaid that is administered by the federal government and would allow people in states like Georgia who have not expanded Medicaid an alternative path to health coverage. Because we know that Medicaid literally saves lives. I was proud to introduce this legislation with my colleagues, Senators Baldwin and Ossoff, and that it has the support of healthcare stakeholders in Georgia and from across the country. Entities like the Georgia Hospital Association and the Grady Healthcare System understand how expanding Medicaid in Georgia will improve health outcomes across the state, strengthen our rural hospitals and healthcare workforce, and create good paying jobs. Medicaid saves lives, it also saves jobs. As it turns out, the right thing to do is also the smart thing to do. And so I'm glad that this plan is on its way to being included in the forthcoming economic package. And I'm going to do everything I can to keep pushing to make sure that it happens. But today I come to the Senate floor to talk not so much about policy as much as to talk about the people behind the policy efforts that we lift up. We should always endeavor to see the human face of the public policy we put forward. And so I want to talk today about Cynthia English. She's a truck driver in Albany, Georgia. It's a town in the southern rural part of our state. Cynthia turns 46 in just a few days. Her birthday actually is this coming Saturday. Happy birthday, Cynthia. Cynthia, hardworking woman, suffers from diabetes and hypertension. She says that she has previously applied for Medicaid and other health care programs, but has been repeatedly denied because she does not have any children. She does not have any dependents. And so she's been denied in spite of her relatively low income. She is in the coverage gap. She says that those denials made her feel like she couldn't get any type of help. In fact, Cynthia says that in the past, her diabetes and her blood pressure have had her, quote, in real bad shape. So much so that complications with her diabetes once sent her to the emergency room. Think about the cost of that for her and for all of us, unable to get the kind of routine care that all of us need, but especially if you have a chronic illness like hypertension or diabetes. Doesn't make sense for her or for us that she's in this situation. Without health care and without health insurance, Cynthia says she couldn't go to the doctor, and that due to the cost, it was hard to pay for medication. To put it bluntly, as Cynthia said, when you're sick in Georgia, they still really don't help you if you don't have any health insurance or Medicaid. Thankfully, Cynthia was able to find the Good Samaritan Clinic in Albany. As a pastor, I have to say that's a good name for a clinic, the Good Samaritan Clinic in Albany. It offers health care to people like her in the coverage gap. And she's been able to receive care for her conditions, including a pinched nerve in her neck and back caused by sciatica, another condition that went undiagnosed for far too long because of her lack of health insurance. If it wasn't for the Good Samaritan Clinic, Cynthia says she wouldn't be here. But it's still not enough. Grateful for them, but that's not enough. That clinic does amazing work, but that's not enough. Mr. President, in other states, Cynthia would be eligible for Medicaid. And according to Cynthia, having additional support provided by Medicaid would help her pay for her medications and get all the care that she needs. Hardworking woman, doing all the right things, cannot get the coverage that she needs. And so, Mr. President, behind the public policy, we have to remember the stories of real people. People like Cynthia. Because there are millions of Cynthias in Georgia and across our nation who need the Medicaid Saves Lives Act. And until we get this done, I'm going to keep lifting up Cynthia's story and the stories of other Georgians who would benefit from this critical life-saving legislation. Thank you